Okay, so if you didn't see the first lecture from Tuesday, I do have it posted in Canvas. So it's under Mod 8, Lesson 1 for neurology. So under that first week there. So yeah, and we went over it a little bit on class on Tuesday, but we can go over it more today as well. So we're going to finish up on neurology today, and then next week we're going to go into behavioral health. So we're going to discuss the rest of the diseases and disorders here. So 1 second, I want to make sure I have this open just in case. Okay, so TIA, which stands for transient ischemic attack, which occurs when the blood supply to a particular part of the brain is inadequate for a limited time. Symptoms can include numbness or weakness in the face or arms, legs, one side of the body, confusion or difficulty talking or understanding, vision abnormalities, difficulty walking, balance and coordination issues, and the patient should definitely seek immediate help just in case it is a stroke. So TIA and stroke, we'll kind of go over the difference between those two. So let's go over the cerebral vascular accident. So a lot of times a TIA and a CVA is called the same thing because they have such similar symptoms. So a cerebral vascular accident is technically a stroke, where TIA is technically not, but it happens when a blood vessel in the brain either ruptures or is occluded, meaning it's blocked, and tissue on the other side of the brain is damaged and oxygen deprived. So this one is called, the TIA is caused by a limit of blood supply to a particular part of the brain for a certain, like a limited amount of time. And then a CVA is when this is either a ruptured blood vessel or the blood vessel is blocked, so that part of the brain can't get symptoms. But they have the same type of symptoms. So they'll have slurred speech, unexplained confusion, headache, difficulty swallowing, but they'll also have that weakness or numbness on one side of their body, facial drooping, difficulty with speech. They might have some more confusion. So it has the same kind of symptoms, but they definitely need to seek immediate medical attention because we can't tell without them getting a scan if they have a ruptured blood vessel or a block in somewhere in there. Or if it's just, if it, and a TIA is serious too, they still need medical attention, but we still need to make sure either it's a ruptured blood vessel or blockage, or if it's for some reason, that limited time where there is not enough oxygen getting to the brain. Does that kind of make sense, the difference between a TIA and a CVA? So basically, on one side of the brain, there is a blockage or narrowing somewhere where the oxygen isn't getting to that side of the brain. So if it's on the left side, the right side is affected. If it's on the right side, the left side is affected. Because your brain actually controls, it's kind of weird. So the right side of your brain controls the left side, and the right side controls the right side controls the left side controls the right side. All right, so some risk factors for a stroke. So hypertension, so uncontrolled blood pressure, diabetes, high cholesterol, smoking, obesity, family history of strokes, arteriosclerosis and atherosclerosis, which is narrowing of the blood vessels and arteries, depending on if it's narrowing of the blood vessel by constriction or if there's like fatty tissue built up there. So it's just a narrowing though for the blood to get through. Heart disease, sleep apnea, sickle cell anemia, as well as cocaine abuse. So one of the number one things though is the uncontrolled blood pressure and diabetes. as well as cholesterol and smoking. I would say those are the top four, and I think that's why they're all listed first, because those are the main things that cause someone to have a stroke, or is at a greater increase of having a stroke, especially if their hypertension, their diabetes, their high cholesterol, if that's not being well controlled, because they could have those, different disorders, but as long as it's being controlled, they won't have as great of a risk of having a stroke, rather than it being not controlled, and then they're at a much greater increase. So. No, that's right. So if there's a blockage on the right side of the brain, then your left side of your body is affected. And if you have a blockage on the left side of your brain, then the right side of your body is affected. So yeah, that's right. It is weird. All right, so some other diseases, disorders, and whatnot with neurology is commonly migraine headaches. Migraine headaches, those symptoms include nausea, vomiting, visual disturbances, throbbing and pain in one side, sensitivity to light and smells as well cause migraines. But triggers, they could be, besides the bright lights and smells, it could be altered sleep patterns, changes in the weather, certain foods, or changes in estrogen levels can cause migraine headaches as well. But it's treated with medications and eliminating certain things out of their diet to use for that kind of treatment. So depending on the severity and if there's medications that haven't worked, then it depends on what they will then be doing. Because sometimes people, to a certain degree, if they're not having medication and their migraines are just not controlled, they're having, majority of the month they're having migraines. They only have 5 days, say, per month where they're migraine free. Sometimes they might do Botox therapy, which helps a lot with the migraines. Another neurological disorder is dementia. And we've talked about dementia and Alzheimer's before, the difference between those two. But dementia and Alzheimer's are a type of neurological disorder. Sorry, my throat's getting all dry and whatnot. But it can include short-term memory loss, disorientation, neglect for self-care, and personality changes, and the inability to follow simple directions is what is defined as dementia. And then dementia and Alzheimer's are kind of linked together, but usually dementia is not as severe as Alzheimer's. Another neurological disorder is epilepsy, or also known as a seizure disorder. It's a chronic brain disorder associated with abnormal electrical impulses generated by some neurons in the brain, which cause seizures. A seizure is characterized by abnormalities in level of consciousness, sensory disturbances, and impaired motor function. So a seizure is not necessarily someone who all of a sudden has their eyes roll in the back of their head, they're on the floor, they're having uncontrollable body movements. Sometimes that person just suddenly loses the sensory, their eyes and everything. How to explain this a little bit better, sorry. Basically, someone can be looking at you and they just kind of lose that sensory around them, and they don't lose consciousness in the way that they fall down onto the floor, but they're just not consciously aware of their surroundings, basically. So sometimes they can have a seizure like that where they're not actually having the full, uncontrolled body movements and stuff. It's just they could be sitting there and all of a sudden just be quiet and they're just staring off into one place. So a lot of times it is pretty noticeable because all of a sudden they're just staring off into one place, and their face kind of gets a little bit pale usually. So but then when they come out of it, they don't have any recollection of what happened at all. Instead of, most people, because we do have that tendency to kind of stare off into space every once in a while. but you usually remember that and kind of snap out of it. Where someone who has a small seizure like that, they won't remember any of it. So, so first aid for seizures. So you want to make sure if they are on the ground, we put a cushion on their head, and then also turn them to their side in case there's any vomiting, because you don't want them to choke or anything. Also to loosen a necktie if they're wearing one. You want to make sure to move objects. So if there is objects around that person, you want to try to move them out of the way. You're not going to hold the patient down or anything. You know, you're going to let them have a seizure, but just make sure that there's no objects in the way that they can harm themselves more. Um, but yeah, make sure you're not holding them down. Don't put anything in their mouth so they don't bite their tongue, like they always say. That's pretty dang rare that that ever happens. I don't even know if that is something that technically has happened. I think that's kind of been a myth. Um, but just wait for them for the seizure to end. Check to see if they have any ID things that say like they have seizure disorders. Otherwise, if they don't, you want to call 911. But after the seizure ends, usually they are not aware of what happened. They don't have any recollection of losing consciousness or having a seizure or anything. They just kind of wake up on the ground and they're like, "What the heck happened? Why is there all these people around me and stuff?" So just try to stay calm and reassure them afterwards. Uh, they're okay. And if help is coming, let them know. Like, hey, we did call, for help, so that way, um, because if it's something suddenly new, I mean, they could have had a head injury like a few days ago type thing, that's causing swelling in their brain. So, yeah, we just want to make sure that they, get treatment if it's something completely new. Otherwise, if they do have seizures, like a seizure disorder, they may just have seizures here and there, but they're not life-threatening or anything. So, all right, encephalitis, which is some swelling of the brain itself, which is different from hydrocephalus, which is excess water on the brain. Encephalitis is swelling of the brain. It's typically caused by a viral infection from a mosquito or a tick bite, and it's pretty rare for that to happen, by the way. But the symptoms range from mild and flu-like symptoms. They could have some convulsions. The very worst things that could come out of it is coma or even death. That's extremely, extremely, extremely rare for that type of thing to happen. But encephalitis, to begin with, is a pretty rare thing to get. Anyways, so it can be treated. So as long as it's kind of caught early enough, if they have signs like that, where, like mild flu-like symptoms, but then they all of a sudden start having convulsions, like that would be like if you have a patient that just had a seizure and they've never had a seizure before or anything, where they get, you call 911 and they get taken to the hospital to see what's going on. But the treatment of these is to use the treatment to ease the symptoms and control fever and seizure activity would be medications usually, maybe antibiotics that would treat the infection. Just kind of depends on the severity of it. So, ooh, good question. I want to know. Hold on, let's see. Let's look at what virus causes encephalitis. Oops. Um, let's see. So mostly in the Midwest and southern states, so not really too much here in Washington. I know we did have like, I think it was a few years ago or something where someone got bit by a mosquito here and they did find like West Nile virus, um, but yeah, it's mostly like in the middle states and the southern states. So mostly in children. Is that what that just said? Where do you see mostly in children? Oh, gotcha. Okay, so meningitis is an infection and inflammation of the meninges and the cerebral spinal fluid of the brain and the spinal cord. So this is pretty much affecting that stem, the spinal cord stem, and it's caused by a type of virus, bacteria, or fungus. And bacterial meningitis is the most serious one. Symptoms include high fever, severe headache, stiff neck, photophobia, confusion, seizures, and positive, and I'm not quite sure how to say this, but we're going to look up what these two are because I have not heard of that before. But someone who has meningitis, like the most common symptom is like a very stiff neck where they can not move like their neck side to side or up and down. Like it is extremely stiff, and it's not that they can't move it because of pain, like they literally cannot move it themselves. So, but let's look up the Brudzinski's and Kernig's symptoms because I am not sure what that is. Brudzinski signs. Severe neck stiffness and hips and knees. Okay. And then what is called the other one? Oh, okay. So Perdings is performed by having a patient in a supine position with hips and feet or hips and knees flexed, extended, send their leg passively. The chest is positive if the leg extension causes pain. So interesting. I've not heard of that before. But yeah, the most common symptom of someone who has meningitis is going to be a very stiff neck and fever. Both of those combined is a pretty big sign that they might have meningitis. Meningitis is pretty rare for someone to get as well. It's not commonly found, but basically antibiotics will help treat the infection, depending on what is causing it. And possibly medications to reduce cerebral swelling, depending on how severe it is. Most of the time, though, people who end up having meningitis, they get treatment fast enough to where they don't have that cerebral swelling. So they're already on treatments for it, basically. Oh, okay. Sweet. So then the rest of this, we will actually get into, oh, wait a minute. Nope, just kidding. Sorry. This isn't the mental disorders and stuff yet. Okay, brain and spinal cord injuries happens from traumatic brain injuries caused by a blow or jolt to the head, mild concussion to severe injury, coma, and death is death is not a very common one, but basically like a traumatic brain injury could be someone who plays, for the 14th edition, it's Mod 8 Week 1. But the most common cause of like a brain or spinal cord injury, it does happen a lot to kids who are playing sports. Baseball or football is the most common one, where they, sometimes they might get a baseball to the head or a football to the head, or they get tackled, and then their head is the one, that hits the ground and stuff. So that can cause a brain or spinal cord injury, and that could develop a concussion. And a concussion, you'd want to ask a patient, like, if they lost consciousness, because they could have the head injury, but they didn't lose consciousness or anything. But loss of consciousness, nausea or vomiting, and if they are feeling really sleepy. If they're feeling really sleepy too, we want to make sure that they don't just fall asleep. We want to keep them awake so we can make sure that there's no brain swelling or anything. Sometimes they might even have a seizure, depending on how bad it is. But usually, as long as they don't have a fever, they didn't lose consciousness, they didn't lose vision, no nausea or vomiting, they should be okay. They just want to keep an eye on the kid and everything, make sure that they're not having any symptoms of that. So, so signs of a concussion: blurred vision, confusion, headache, nausea, vomiting, slurred speech, possibly loss of consciousness. So, yeah, but again, that is more common in kids just because of the whole, a lot of kids play sports, so they just have that risk factor of, baseball bats and baseballs and footballs and things, like hitting them in the head or being tackled to the ground. So, delayed signs of a concussion is a persistent headache, dizziness, inability to concentrate, repeated problems with memory, nausea or vomiting, unusual irritability, anxiety or anger, sleep disorders, or potentially seizures. So this is something that can happen later on. They want to make sure, you keep an eye on that person to catch the signs earlier first before it gets to this point. But it could be, 4 or 5 days later, and then they start having more severe symptoms. So even if someone is having just a slight headache with just a little bit of blurry vision or something, it's better to be safe than sorry, because then you don't want it to get to the point where they start having the seizures, because then usually they're admitted to the hospital, because they might have encephalitis and might have to have the pressure taken off from their brain. So then they have to be medically induced to be unconscious, basically. So there's a certain word for that. I'm sorry. Slurred speech, like if you've ever heard someone who has had a lot to drink and the way that they kind of just slur their words together and stuff, or they're just like, hey, I'm just going to try to do an example, and I'm going to do a horrible example. Oh boy. But have you ever been around someone who's been really, really drunk or anything? The way that their words kind of just mesh together, they're not quite sure even what they're saying, really. No? I don't know how to demonstrate that. I'm not very good at that. Oh my gosh, I don't know how to demonstrate that very well. Maybe we'll do that in class later, where it's not recorded and posted forever online. So, but yeah, I have to figure out how to do that. So, anyways, some more serious injuries to the brain can cause the formation of a contusion or bruised area, basically, usually because base of the skull fracture. So symptoms include headache, nausea, vomiting, visual disturbances, sensitivity to light, reduced concentration. So all of the symptoms basically of a concussion and contusion are the same. So, and then this is the list of different types of injuries, so open and closed injuries. And closed injury, brain injury occurs but the skull is not fractured, where open, the skull is fractured or displaced. So shaken baby syndrome, most common reason for serious head injury in infants. This one's pretty sad. So basically, like an infant, they can't really hold their head up. They don't have the muscles and the strength yet to really like control their head. So their head is just kind of like, almost like a bobblehead where it just kind of goes over the place and stuff. So if someone was to shake their baby or anything, their head, they kind of get like whiplash. So um, honestly, that is something that is common enough where it has to be discussed. But yeah, this one is pretty sad because it's usually like a parent who's frustrated, they're not getting enough sleep, or some issues with that, and then they don't mean to harm their child or anything, but even like a light shaking and stuff can cause a head injury. Certain head injuries can cause someone to have paralysis, so meaning like they either don't feel anything below the waist or on their arms and legs. They may not feel that, may not have any control over their arms and legs anymore. So someone who doesn't have control over their arms and legs is a quadriplegia, and then someone who just has below the waist is paraplegia. Parkinson's disease is another common medical neurological disorder. It's a pretty chronic, progressive, and debilitating disease that affects about 1 in 100 adults over the age of 60. Their symptoms are going to be tremors of the hands, arms, legs, jaw, face, rigidity of limbs, and slowness of movement, and instability, impaired balance and coordination, and it's caused by a deficiency of the neurotransmitter dopamine in the brain. Have you guys ever seen someone who's had Parkinson's disease before? Because your brain development starts to decrease when you get older. It is sad. So tumors. So initially, symptoms can be headache, vomiting, dizziness, diplopia, which is like the pupils of their eyes are not the same. So one pupil might be larger than the other. Alterations in muscle strength and coordination. So someone, they might have, they might lose some strength or coordination here and there in, say, like their right or left arm or whatever. But it just happens every once in a while. Certain cancers, so lung cancer, breast cancer, melanoma, those frequently spread to the brain and metastasize, and that can cause those tumors. As a brain tumor grows, they cause some serious problems and complications for the patient because, of course, there's such a limited amount of space inside the skull, so it's causing pressure against the brain. Sometimes they can remove them though. So just depending on where the tumor is at, but they can do radiation as well to stop or slow the growth of that tumor. So just kind of depends on where it's at, if they can remove it, otherwise they'll just do the radiation. Multiple sclerosis is another neurological disorder. It's an autoimmune reaction that causes progressive inflammation and deterioration of the myelin sheaths of nerve cells. Symptoms include numbness, paresthesia, diplopia. Again, that's where they have the different, their pupils are different sizes, and bladder control symptoms. They also will have lots of pain as well. A lot of times these kind of come through cycles, so where they'll have, a remission period where their symptoms are a lot better, and then a relapse where they kind of go into an episode where their MS is worsened. And those can kind of be caused by like stress or other external factors that can make someone, like an episode be more severe than others. So, amyotrophic lateral sclerosis, so rapidly progressive and ultimately fatal neurological disease that destroys the motor neurons responsible for voluntary muscle control. So it affects muscles, but generally not the mind. But the treatment can include, I'm not quite sure what that is. I'm thinking that's a medication to minimize neuron damage in palliative care patients. Let's look at what that is. Yes, it's a medication. Okay. Bell's palsy is temporary facial paralysis resulting from inflammation and edema of the seventh cranial nerve caused by a viral infection. Disorder usually subsides spontaneously over several weeks, so it usually kind of treats itself. Sometimes an antiviral drug, such as acyclovir, can be prescribed to help with the symptoms, like get the patient back to normal sooner rather than later and everything. So it'll help in that process. It'll almost kind of look like they've had a stroke, but they did not have a stroke. So peripheral neuropathy is not a disease, but a condition of the nerve dysfunction from over 100 different causes. So lots of different things that can cause that. No. Um, Treatment for peripheral neuropathy is most effective when the cause, the condition is diagnosed, and then they can treat the neuropathy. So because there's so many different things that can cause it, the treatment just really depends on what causes the peripheral neuropathy, meaning that they have like numbness in their hands or feet, basically. So it just depends on the cause of it. Okay, so the rest of these we will get into next week, where we'll go over mental health stuff. So I will make sure I'm going to post this PowerPoint for you guys too. I know a lot of it is stuff that is from your books already, but there are some extra notes and stuff that I put like on the side if you go into presenter view. So I will make sure that that gets posted. But when you go in there and you see like there's 50 some odd slides, we're going to get into that stuff next week. So this week we're just focusing all on neurology. Next week we're going to focus on behavioral health. So yeah. All right, and then if you guys didn't see the first video, the first lecture, and you want to watch that, it's going to be in Mod 8, Week 1. Let me find it real quick. And it's about 15 minutes long. Hold on. Yeah, so it's going to be Neurology Lesson number 1. When you click on it, you will have to click, because it'll come up and say YouTube refused to connect. Go up here where then it has an underline, and then click on it, and then it'll open up to the YouTube page. So yeah, it's not too long. But what we can do, we can go over this more this afternoon too, to discuss neurology and whatnot a little bit more in depth when you guys come to class. And then we can also go over the skills needed for this chapter. So a daily puzzle. What's a daily puzzle? A riddle. Okay, yes. Do you want me to do that this afternoon? Okay, I will put a riddle on the board this afternoon. Alrighty? All right, guys, see you later.